So without further ado, let's go ahead and get started. Thank you all so much for joining. Just a reminder, kindly open up your chat box, whether on YouTube, Instagram, or here in the Zoom classroom. I would invite your participation, and we will be going through or conducting a live Q&A at the end of this session. So please keep your questions until the end, write them down, and would love to go through each of them towards the end of our session today. Today, what we're going to be doing is going through a very unique and innovative topic. How can we marry ChatGPT in all of its glory and power and all of the buzz with USMLE preparation? Many of you are probably studying for the USMLE right now. And if so, go ahead, type into the chat box. Are you studying for step 1, step 2, shelf, comp? Go ahead and type into the chat what USMLE exam or NBME based exam are you studying for?
Nice. Lots of step 1s. Step 2, comp. Great.
Excellent. So today we're going to be really focusing on both step 1 and step 2, and we're going to go through a very live demo. And again, I would encourage you to stick around until the end, because what we are going to be doing is releasing our very exclusive Notion template that has a list of prompts that you can use, just kind of like a study sidekick, whether you're studying for step 1 or step 2. For many of you all, this may be the first webinar. Certainly, Jake, this is our first webinar together. It's super exciting. But I'm just going to spend a few minutes introducing myself. And Jake, I'll kick it off to you as well. For those of you who have not seen me on YouTube or gone through any of my resources, I welcome you. My name is Rahul. I am a practicing pediatric critical care physician, very passionate about medical education. I'm just about a month away from graduating with my master's in medical education. That has been a journey in and of itself. But over the past 7 years, I have been absolutely passionate about helping students just like you kick ass on the USMLE Step 1 and Step 2 exam. I always am fueled and eager to connect with students. So please feel free to email me with any questions, and I'll do my best to get back to you in a very prompt manner. Many of you have seen some of my courses. I do want to let you know that I have kind of these rapid review, active recall based courses that are great if you are a few months out from your exam or are especially in dedicated study. I have the Step 1 Pass Fail course, which is about 70 hours of high yield integrated organ systems based material. And then this past year, I just released my Step 2 CK course. And last week, I added the surgery shelf. And that course is a comprehensive 40-hour course, again, based in active recall and vignette-based learning. And I go through each shelf step by step, as well as the high-yield questions and topics that are frequently assessed on NBMEs and beyond.
Thank you, Dr. Damania. Really excited to be here with you all. Just a little background for me, if you've never seen me, or maybe you have seen me in one of those fun Guess the Disease videos on your Instagram reels. But my name is Jake, and I'm current third-year medical student at the University of Queensland, and so I'm going to be graduating next year in a 4-year MD program. I know a lot of you have typed in that you're studying for Step 1, and I was there just last year, so I know exactly what you're going through, whether you're in dedicated already or dedicated's coming up. Hang in there. I know, it's a stressful time. It's long days, but it will all be worth it. And really my goal with what I'm doing with MedSchoolBro and my resources is to package together all of what I felt wasn't available when I was going through Step 1 and dedicated. And that is similar to the principles that Dr. Damania honed in on with integration, visualizing concepts, applying them to vignettes that you'll see on test day. These are the kind of applications that I was trying to package all together in resources such as these guides. And on screen here, you can see an example of my pages, definitely inspired by a visual approach, and that's the way I learn. I tried to really integrate all the disciplines. As you can see, the histology is on the same page as the microbiology. If you're looking at on the one on the left there, H. pylori and its integrations with chronic gastritis. Okay, well, what are the layers of the epithelium of the stomach, right? The histology is right there. Okay, well, what about the pathology? Well, in gastric cancer, in diffuse gastric cancer, for instance, what we see characteristically those signet ring cells, right? And so just integrating all those kind of concepts together was a way that I learned, and I was doing everything I could to package this together for you guys to do the same, to supplement again when you're a little bit further down the stages of your step 1 prep and you need some sort of rapid review material that kind of has everything condensed, packaged all in one place. That's what really inspired me and drove me to create these guides. Cardiology, neurology, gastroenterology, endocrinology is out. MSK Derm will be in a few weeks, but definitely check them out if you're interested. But we're going to move on to what we're here for today, and that is USMLE and ChatGPT.
Absolutely. And Jake, you and I have, since we've met, which actually was not too long ago, we have surfaced a mutual love in these principles. And that is first in vignette focused learning. I mean, even when I am mentoring students one-on-one, I focus on creating either Anki cards or Notion notes on UWorld or NBME incorrects that are focused really on capturing the essence of the vignette. And then when you are reviewing, going through reviews of certain concepts and vignettes in a very active recall manner.
Amazing. And similarly of what I just spoke about, integration is a foundation that both of us definitely hone in on with our courses and materials. And I think it's really important because learning medicine in isolation is not very effective in making the connections and understanding how systems are connected, how physiology can relate to the pathophysiology, and then how that relates to management, and why we're prescribing certain medications, why we're ordering certain imaging, or et cetera. And so I think always keeping in mind how you can integrate something you learned from a cardiology section with then maybe respiratory is something that is super important, and principles that we strive for.
Absolutely. The third principle that we both absolutely base our resources on and our methodology towards USMLE preparation is honing in on test-taking strategies. Now, this just doesn't mean that we are giving you some cheesy techniques here and there. What we really want to focus on is clinical reasoning. I mean, at the end of the day, yeah, this is just an exam. What we are really focused on is inspiring a student like you to become a kick-ass resident and beyond. And so what we do is we create a very strategic approach to questions, how to break down the vignette. And Jake, I'm super excited to go through our vignette breakdowns that we've been practicing together as we prepare for this webinar.
Yeah. And amazing. I think this last piece ties beautifully into what we're talking about today, and that's technology innovation. Building in Anki, building in different resources into your study system that can hone in on the principles of active recall, that can test your knowledge and kind of expand your application of the material. And I think today with ChatGPT, it's going to be a great integration of how technology can really supplement that learning process for you.
Absolutely. Well, let's go ahead and go through a quick introduction of how the next probably 40 minutes or so is going to look. Truly, we want to leave enough time for questions. If you are dealing with some sort of study issue or want to clarify things for either step 1, step 2, or anything med school related, we would love to connect with you all in the live Q&A. But before we get into our introduction, everybody doing okay? Go ahead and type in yes into the chat box. Everybody staying active and engaged? Good. All right. Wonderful. Again, super grateful that you all are here spending your evening, morning. I know in Queensland, it's morning time, and here in Ohio, it is a beautiful evening. So going through now our session outline, what we're first going to be focusing on is how to create an effective prompt in ChatGPT. I'll let you in on a secret. That is my 3C model. And that 3C model form the building blocks of how you can create an effective prompt, not only to study for the USMLE and what our prompt guide is based on, but if you need to use ChatGPT to write an email or any other productivity or task that you are going to be utilizing it for. We're then going to be going to break down, the NBME question writer guide. Now, this is what we based our template on. The NBME question writer guide is a PDF that the NBME uses to write high fidelity questions, the questions that you utilize for your practice exams, and UWorld kind of uses those same types of principles and pillars. The majority of the session is going to be focusing on orienting you to our collaborative Notion dashboard, which has a series of prompts that you can use. And we will be sharing the link to that at the end of the session, and we will be posting it as well as a follow-up. We're going to first dive into the first section of this, and that is going to be, how do we create an effective prompt? Now, when I am looking at ChatGPT, the field that really interests me is something called prompt engineering. And as many of you know who have utilized ChatGPT, if you put garbage into ChatGPT and just make something superficial, well, you're going to get a pretty non-helpful response. I mean, let's say, for example, you write something, write me a question on achalasia. Well, the USMLE or ChatGPT won't understand the nuances of what kind of question you want. Maybe they'll just give you a very superficial single order question that's not really a vignette, that's just a flashcard or something like that. And so that's why prompt engineering bridges this gap. It allows for us to have a very unique input into ChatGPT so we get a high value output. And so what we're going to be doing is going through the 3 building blocks that I use for any prompt. You can use this on your own if you are using ChatGPT, again, for any sort of endeavor that you would use ChatGPT for. And these building blocks are kind of like Legos. They are going to build upon each other. So the model that I use is the 3C model. The first C stands for context. The second C stands for creation. And the third C stands for clarity. Let's go through each one. The first one is going to be context. When it comes to context, you want to think of this like a Bumble or a Tinder date. What do you do the first time you meet somebody? You say, hello, my name is. And what you want to do is you want to give ChatGPT a lens of who you are. I am a third-year medical student studying for the USMLE Step 2 CK. Another thing that you can say is that I am blank, your role, and what you want ChatGPT to be. I'm a third-year medical student, and I would like for you to act like a USMLE tutor. So building context is always very important. Now, the creation portion is going to allow for ChatGPT to understand what you're all about. Why did you come to ChatGPT? I'm a third-year medical student studying for the USMLE, and I want you to write an NBME question related to Hirschsprung's disease. The creation building block always has an action verb associated with it. Create, generate, organize, summarize. It's an action verb. And then clarity. Clarity is really unique because what clarity does is it allows ChatGPT to center itself on the topic at hand. I'm a third-year medical student, and I would like for you to write me an NBME style vignette on Hirschsprung's disease. Here's the clarity part. Provide me the correct answer and a succinct bullet point explanation. Do you see how that allows for that just added layer of nuance so that then you can iterate on that? Context, creation, and clarity. These are the 3 prompts or 3 building blocks, that we've based our ChatGPT USMLE prompts on.
Amazing. And speaking off of that, everyone, the principles in which we've really created a little bit of that nuance in how we've organized those 3 C's is really through the inspiration of the NBME's Writer's Guide, because who's writing the question, guys? It's NBME. And so we want to follow kind of their thinking when it comes to a hierarchy of creating questions and good vignettes that you'll see on test day. And so the first big key point to hone in on everyone is that questions that you'll likely see and that they're going to write for you are going to test application over recall. And so that means, memorizing a little factoid about let's say a tumor marker, et cetera, might be important for just the foundation of your understanding. But how does that apply in the clinical application or management of this patient? Or how does that stratify them based on risk, et cetera? And so really hone in on application over just recall. The next point is to apply important content rather than what we call do not just chase zebras. And what that exactly means is kind of an extension of the top point. Don't focus too much or concern yourself too much with that minutia of every single small detail when it comes to things you come across in your study, or even things that they might mention in the vignette. Always keep the bigger picture in mind and focus on the high yield principles. Okay. The next is that the number of questions in particular, is actually proportionate to the topic importance. And what might be an indicator of topic importance? Well, they're going to test you based on the clinical importance, right? And so something like heart failure versus something like a very rare congenital heart condition, for instance, what do you think the NBME is going to test you on or have a higher chance of creating a question for? Probably heart failure, right? Because that's has a lot more clinical significance and is more likely something you're going to come across in your rotations and your career, right? And so the next part is that really focus in on applying the concepts to clinical problems. And so, a lot of what we've already talked about, always keep in mind how is what you're learning from a book, from first aid, from my resources, from the summarized notes in the HyGuru course, how can that actually apply to a clinical problem at hand? So always think in a vignette manner, always think in the clinical context when you're thinking about how that information is applicable. Now, there's always going to be a single best answer and closed response, which kind of leads into the next point as well, which is they're not trying to trick you, and you can answer the question with the stem and lead in alone. So there's not going to be some other background information or essentially they're not trying to confuse you. There's one best answer, and you'll be able to answer that from both the stem and lead in alone. Again, the test writers are not trying to trick you, although I know on some UWorld questions, a lot of you post about this on your story. The ones where 65% of everyone, selected the answer that is incorrect, and like 4% put the right answer. UWorld might be trying to trick you, but I can promise you NBME is not. Vignettes are in the same format as your history and presenting complaint. So again, coming back to kind of the clinical applications and things like that, the vignettes are typically organized in a way that you'd expect to see maybe in a handover and a quick summary, right? A quick history of the patient demographic, 43-year-old male with, decompensated heart failure, presenting with, XYZ. Keep that in mind with how the vignettes are arranged and oriented.
Awesome. Well, with that background in mind, prompt framework, as well as looking at this study guide through the lens of an NBME, we're going to be going through a live demo of our ChatGPT prompt guide. How many of you all have seen this prompt guide before? I know we released it a few days ago on Instagram and via email. Have you all taken a look at that just yet? Go ahead and type your answer into the chat. Okay, some mixed responses. Jake, I'm super excited to have you orient us to the dashboard and give us the background and expose the power of this guide.
Amazing. Let's do that. Just going to take over and share the screen here. Let's do this. Just kind of get a thumbs up. Everyone can see that okay? Yep. Amazing. So I know just looking at that response, some of you guys have seen this landing page. Some of you haven't. If not, don't worry. At the end, we'll make sure that you guys all have access to this and these prompts. But essentially, when you land on the page, this is what you're going to see. We've embedded an overview video, which is a 5-minute video that we put together just essentially doing what I'm doing right now, guiding you through how to use the Notion effectively, how to copy and paste the prompts into your ChatGPT, how to essentially utilize that within ChatGPT as well. I won't dive too much into that video. It's there for you if you want. If you scroll down here, you'll see a little bit about the building blocks, the 3 C's that Dr. Damania touched upon. And then you're going to see here the 3 prompts that we've created for you. And so today we're going to be honing in on a few of these and showing you how to utilize them in your study. So this is the landing page, pretty simple to use. All you're going to do is you're going to hit this dash arrow for whatever you want to do. So if you want to write a foundational science vignette for USMLE Step 1, we know the basic sciences are key principles that Step 1 hones in on, right? And so talking a little bit about how we've generated the prompt here, things like cause and effect, mechanism of action, infectious agent, right? Tying in your microbiology, explanation of these findings, up arrow questions or down arrow questions, for instance. These are kind of the ways we've tailored these prompts. And then you can go through yourself and kind of look through exactly how we've even provided examples of questions. We've utilized a lot of those elements that I spoke about in the NBME item writer guide to really generate the most succinct, homogeneous output for you to help support you in your study. And so without further ado, I might just tutor you guys and show you how one of these ChatGPT prompts is super, super effective when it comes to helping guide you through an NBME question, a UWorld question, any multiple choice question, even if you're, for shelf exams, for any question that you come through, really effective in how these prompts can support you. So I'm going to take you through this Tutor Me Through a Step 1 vignette. And what you guys are going to do is exactly what I'm doing. So you're going to land on the page, you're going to scroll down, and you're going to see this dashboard. What you're going to do is you're going to copy and paste all of this here to the bottom, and then you're going to go into your ChatGPT window and you're going to hit paste. Now, specifically for this prompt here at the very top, we've outlined if it's a Step 1 or Step 2 CK prompt. Again, this will help tailor the GPT a little bit more because, again, Step 1, a little bit more focused on your basic science principles. Step 2, more management clinical applications. And so I'm going to be guiding you through a Step 1 question. So we're going to put that into the ChatGPT and you're going to hit enter. Now we've ended the prompt with, do you understand this task, just to make sure and reinforce the ChatGPT that they've understood the task and now that they're ready to get the question. And so let's say you're going through the free 120, everyone, and you're as part of your dedicated, and you're going through the review, and you're like, there's no rationales. I need help guiding through this vignette, this stem. Well, like you see me doing here, simply copy and paste the vignette in, hit paste, and look at ChatGPT and what it outputs here. So just starting from the top, we have key concepts and knowledge points from first aid, how to approach the NBME question. And then look at this, guys. Similar to what you're going to see in the courses with HyGuru, similar to how I've broken down questions on YouTube and Instagram, breaking down the vignette into digestible pieces and understanding the clinical significance as you go through. And so, if we just kind of take it a chunk at a time here, 39-year-old man comes to physician because of 6-month history of progressive shortness of breath. Right? This is your chief complaint. We talked about NBME writer guide, right? Starting off the H and P, right? He has a cough productive of white sputum for 2 years. Okay, so this is a little bit more chronic in nature, and we're giving a little bit more context when it comes to a symptom. And this can raise suspicion of particular respiratory pathology, right? He smoked 1 pack of cigarettes daily for 16 years. Okay, so chronic smoker. We know that's a risk factor for a whole category of respiratory pathology. He's in a mild respiratory distress with pursed lips and barrel chest, and he's using accessory muscle respiration. Okay, so now we're given specific features on examination, right, that might suggest a certain pathology. And what are we thinking, right? Blue bloaters, pink puffers, right? We're thinking maybe this is a COPD picture or exacerbation. All right, let's continue down. Breath sounds are distant and crackles are present. Okay, so more findings on examination that help bring the clinical picture to life. That may suggest, of course, air trapping and hyperinflation. And then we finally get some interpretation of spirometry here with the FEV1, FEC ratio. And because that was decreased, right, less than 0.7, we're thinking that might be an obstructive pathology, a problem with air trapping, right? We can't expel air properly. And so as you can see, super powerful in how it can dissect the vignette and give you clinical reasoning right next to it. And then not only that, but it will dive into the incorrect answer choices and as well give you key features that you'd expect to see in the vignette to make that answer choice correct. And so if this was an asthma picture or an asthma vignette, right, we'd expect to see other things like wheezing, or you expect to see a significant response with a bronchodilator, right? It's a reversible pathology. Bronchiectasis, right? We're thinking this is copious chronic amounts of sputum on CT, right? And in progressive stages, you can get the honeycombing. You can get those permanent dilated clogged up air spaces, right? Pulmonary fibrosis, right? On examination, we talked a little bit about some of the findings here with Distin and Crackles. Well, with pulmonary fibrosis, right? You would expect to see a more restrictive pathology. So our FEV1 FEVC ratio, right, might be normal or greater than 0.7. There might also be some risk factors mentioned. Maybe there's he's a shipyard worker or something that's related to one of the occupational pneumocoses, right? Silicosis, berylliosis, all those ones. So as you can see, gives a nice summary as you go through with this table, and hones in on some of the writing strategies and principles used, as well as the task competency tested for this picture. And just a quick rapid review, guys, with some of this. Remember emphysema, right? We have our pan-acinar and our centro-acinar. Remember, smoke, hot air rises, so smoking is going to affect your upper lobes, whereas something like a alpha-1 antitrypsin deficiency is going to cause effects in the lower lobes, which is your pan-acinar emphysema. So yeah, that's a little bit about just how powerful this prompt is. For the purpose of time, I won't show an example of the foundational science vignette one, but it is here for you guys. You do the exact same thing. You would just hit the drop down here. There's Loom videos embedded for all the prompts as well to help guide you. Copy and paste all the way through. And if you want to do the reverse, so let's say you're not having trouble with a question, but you're having trouble with a concept, a diagnosis, a topic, a medication. Well, what you can do is this prompt in specific will actually generate a vignette that you can test yourself with. So, let's say you just went through all of that and you're having trouble with the topic bronchiectasis and you didn't understand how that was integrated into the answer choices. Well, you copy and paste this prompt into your GPT, and then it'd prompt you and ask you what topic, diagnosis, or concept are you having trouble with. You put bronchiectasis, and it'd actually tailor and create a vignette all about bronchiectasis, and then prompt you with a step 1 focus basic science question to lead into that. So hope that provided some good insight into just how powerful these tools are, and I'll let Dr. Damania take over from here.
Absolutely, Jake. Well, thanks so much. This is some really innovative and unique stuff. How many of you all agree? Do you guys feel like this is something you would potentially use as you are studying, or at least be open to trying out? Go ahead and type your responses into the chat box. And, it's not for everyone. Absolutely, it's not for everyone. But again, this is just a glimpse, I think, into the future as large language models like ChatGPT are going to expand. So Jake, are you ready for step 2 question?
Let's go through it. I'm ready.
All right, awesome. Well, many of you on this webinar today are studying for a shelf or step 2. So from the prompt guide that Jake just went through, I'm going to use the same tutor me through a prompt. Okay, everyone. And I'm going to change this. Rather than step 1, I'm going to put my step 2 CK hat on. And just as a small nuance, I am going to be using ChatGPT 4. Jake was using ChatGPT 3.5. You can use either. ChatGPT 4, as many of you know, is the premium or paid version. But again, you can use either. So here's a nice enter. Do you understand this task? ChatGPT is like, I understood the assignment. All right, here we go. So what we're going to be doing is we are going to be taking a vignette. And one thing that I will say is that as you put a vignette, you should consider putting the right answer. Now, ChatGPT may get to the right answer majority of the time, What I have found helpful is putting a vignette that you need help on or a vignette breakdown on, and then putting in the answer. So let's just go through real quick this vignette. I hope you all can see this. And I'm going to actually pause after I read through the vignette, and I'm going to ask you all what you think the answer is so I can prompt ChatGPT, hey, this is the answer. Here we go. 65-year-old man comes to the office with a 2-year history of progressive shortness of breath on exertion and a 6-month history of non-productive cough. So we know that this is chronic. He now has shortness of breath when walking to his mailbox, so it's exertional. He's not had any fever, weight loss, or chest pain. He's not had any recent sick contacts, no occupational exposure, and does not own any pets. So a lot of pertinent negatives. He has difficult to control AFib, hypertension, COPD, and migraines. Medications are going to be amiodarone, remember, potassium channel blocker, warfarin, vitamin K antagonist, lisinopril ACE inhibitor, tiotropium, and ipratropium. They are going to be antimuscarinic. Propranolol is going to be a beta blocker. Temperature, afebrile. Pulse is okay. Irregular. Remember, he had AFib. Respirations are this. Blood pressure is okay. No JVD. Auscultation of the lung discloses fine crackles, significant of maybe some fibrosis going on. No egophony, indicating no real consolidation. Remainder of the physical exam shows no abnormalities. An adverse effect of which of the following is most likely going to be present in this patient? Go ahead and take some time, type into the chat what you think the answer is. I like it. You guys are all staying active and engaged. Jake, what do you think?
Yep. I think amiodarone is yep, we're going with the amiodarone here. The
All right, sounds good. Why don't we kind of pause here and just go through what are the steps we went through. What we are doing right now is we are doing a tutor with me from the prompt guide. I put it as a step 2 CK vignette. And now, again, I'm using the vignette. I need a breakdown of it. I want it to tutor me. And I put the correct answer so that then it can center itself on the correct answer. All right, so here we go. Key content points. You all were very right. It is amiodarone. Basically, the key things that you have to know is that amiodarone causes pulmonary fibrosis and interstitial lung disease. Guys, guess what? Jake went through obstructive. We were very intentional. Let's integrate respiratory pathophysiology. So I am going to go through a little bit of restrictive. Obstructive, can't get the air out, air trapping. Restrictive, you can't get the air in. You breathe at very low lung volumes. And so as you can see, this prompt also incorporates, because it's step 2, clinical reasoning. This prompt also is similar to the step 1 tutor with me, is going to go through the incorrect answers. It also is going to give you a if-then statement. Now, this is called cognitive loops when it comes to test taking. If you see amiodarone, then think pulmonary toxicity. If you see this, then think this. And if you all are going through UWorld or NBME questions, that is exactly how I want you all to learn and review, so that then you're building, and you have this kind of quick association, so that then even if you're struggling with timing, you know that I need to stay active, such that when I see a stimuli, bam, think about pulmonary toxicity in the case of amiodarone. What I like, and I know, Jake, you highlighted this, that there is a follow-up vignette that just kind of helps you reinforce the point. Obviously, you know the answer is amiodarone. This question is not to assess you as much as it is to reinforce. Every amiodarone pulmonary toxicity question is going to have diffuse crackles. Jake, would love to hear your feedback on this, and we're going to kind of transition into the vignette breakdown. But what are your thoughts so far?
No, this is super exciting. It's great to see that lots of people are excited about this, and just demoing through and taking them through exactly how we see this kind of being incorporated into the study process. And a lot of the principles that we already have honed in on when it comes to our reasoning and kind of application of how to approach question stems. It's amazing how the ChatGPT, with the power and generation of our very succinct tailored prompts, can create such a powerful output. And so with that being said, we're gonna do a little bit more diving into vignettes, and I'm going to specifically take you through a step 1 vignette here myself. And I want everyone to read this one with me, and we're going to answer this one together. And then I'm going to dive into the reasoning and how I think it's best to approach questions like this. And I think we can draw from a lot of the principles that we just saw the ChatGPT model do. So it's amazing to see how this can all come together to help support you. So let's get into it. 41-year-old woman with no previous medical care comes to the physician due to 3 months of progressive difficulty in swallowing both solids and liquids. All right, so right off the bat, right, guys, we're given 41-year-old woman, no previous medical care. Okay, so think about that as being a risk factor. And then we have specifically with the present now, 3 months of progressive difficulty, dysphagia, to swallowing both solids and liquids. And already, guys, I want you thinking, solids and liquids, progressive dysphagia, what are potential things that are already coming to mind here, guys? Think about if there's a problem with swallowing only, right? Then we're more thinking of a mechanical or obstructive thing, right? Like a stricture or a web. If we're thinking fluids only, perhaps that's maybe more neurological in nature, right? Something like a stroke or something of that kind of domain. But if we're thinking both solids and liquids, maybe we're thinking a malignancy. Maybe we're thinking achalasia, beautiful, Ahmed. Maybe we're thinking esophageal spasm or scleroderma are one of those. All right, let's continue. She recently immigrated to the United States from Brazil and has lost 10 kilos over the past 3 months. All right, some constitutional symptoms, gives us a little bit more background. So no previous care, immigrated from the United States, maybe some sort of chronic systemic thing. She has unprotected sexual intercourse with multiple male partners and has not been tested for any STIs. Okay, so another risk factor. On examination, the patient has an S3 murmur, lung crackles, and dilation of the proximal esophagus prior to narrowing of the distal esophagus on barium swallow study. Which of the following findings would be expected on distal esophageal biopsy? All right, everyone, I want you to put your answers into the chat box, and then we're going to dive into this question. Very, very great, Juliet, Adrian. I'm seeing a lot of C's. And if you are putting C, you're absolutely correct. This is a picture of achalasia. It seems that this chronic kind of picture might tell us a little bit about T. cruzi infection, right? More endemic to regions of Central and South America. And achalasia is a sequelae, right? We have our megaesophagus, achalasia, megacolon as something that's more chronic in course. So I wanted to integrate how my guides can really support you in approaching vignettes like this. And when it comes to this question in particular, the answer was related to the myenteric plexus, right? And so, you know, on a page of my guide, you're going to see the physiology. You're going to see my fun memory tricks, right? Myenteric, muscularis propria, motility. Meissner has 2 S's, so you're thinking submucosal nerve plexus secretes fluids, right? To remember the function there. And just the general organization SM really helps me understand the layers of the GI tract, which will then tie us really, really nicely into the next slide, which is the integration with the pathophysiology. And so with my approach with these guides, as I've mentioned from the beginning, it's all about integration and learning concepts that are related to one another. And so if I'm talking about the organization of the GI tract, for instance, and those different layers, well, let's talk about Hirschsprung's disease and achalasia right on that same page, right under it. Because why? Well, these are problems, right? In the context of Hirschsprung's, which is a lack of ganglion or enteric nerve plexus, both your myenteric and Meissner plexus, right? That's in the distal colon, right? When you get failure to pass meconium in the first 48 hours, right? The bilious emesis, we know that's associated with Down syndrome. We're going to dive into management of that in the next prompt. And then so to contrast that and to tie this back to the question, right? Achalasia is a degeneration of the myenteric plexus, but this is in the lower esophageal sphincter, right? And actually, most commonly, achalasia is an idiopathic course, but it can be secondary to T. cruzi infection, which is what we saw in the stem, which is again endemic to areas in Central South America. Remember, it's classically known as the kissing bug. It has 3 phases, right? In your acute phase, you can get the chagoma and Romana sign, right? Which is that edema, painless edema in the eyelids and inflammatory edema. In its intermittent phase, it's going to be more asymptomatic in course, right? Latent. And then chronically, 10 to 12 years later, you can get those features that we saw in the stem, right? We saw that S3, that dilated cardiomyopathy. Right now, we're making connections back to cardio, right? S3 sound. That can be a risk factor for a mural thrombi, for instance, right? Stasis of flow that can build up. And then from a GI lens, this damages our myenteric plexus, which we've talked about, and this can cause this degeneration of inhibitory neurons in the myenteric plexus. And then on manometry, you'd expect to find that increased LES pressure in that classic bird beak appearance on barium swallow. And so a great little way to tie my resources. And I think I just got a comment from someone asking if it's on Amazon. We're not on Amazon right now, but if you go to medschoolbro.com, you'll find all the resources and guides there, both available PDF and digital, PDF and hard copy, as well as it comes with a custom Anki deck. But I'm going to let Dr. Damania take over with a vignette breakdown that's related to this, but now again, focusing on the principles of step 2 CK.
Awesome. Well, I am really excited to get into a little bit of shelf and step 2 land, but just for some live feedback, I know it's tough because Jake and I are just like talking in front of the camera across the world. I'm in Ohio, he's in Australia, but are you all resonating with this topic and theme? Everybody having a good time so far? All right, Adrian, Maria, thank you all so much for your participation. Let's go ahead and get into a step 2 CK question. So similar to Jake, I'm going to be going through line by line, breaking it down. I'll start with the stem. Which of the following is the most appropriate next step in management for this patient? A 3-day-old male with abnormal tri-screen prenatally is brought to the pediatrician due to failure to pass stool. So in this situation, what we notice is that this is failure to pass meconium in a neonate. And with an abnormal tri-screen, especially if the beta-HCG and the inhibin are going to be abnormal, what we are going to be thinking of right away potentially is trisomy 21. He was born at term following an uncomplicated pregnancy and delivery. There is no history of vomiting or fever. Now, guys, this is very important. This in an NBME vignette means that it is a pertinent negative. It rules out, in this case, something like gastroenteritis that would present with fever or vomiting. On exam, the abdomen is distended and slightly tender to palpation. So you know that there could be air or some sort of pathology in the abdominal region. There is no rebound or guarding, so there's no peritoneal signs that you can see, another pertinent negative. And here is key to the vignette. Rectal examination elicits the expulsion of small amount of stool followed by significant abdominal distension relief. What do we call that physical exam sign? That is that squirt side where you are going to get the expulsion of the stool. So go ahead and type into the chat. What would you do for this patient right in front of you? A, perform an abdominal ultrasound. B, exploratory laparotomy. C, perform rectal suction biopsy. D, air or contrast enema. Or E, upper GI series. What do you think is the best answer? And I'd encourage everyone to participate here. Excellent. If you are saying confirm the diagnosis, you are absolutely correct. The answer here is going to be C, perform a rectal suction biopsy. Remember, for intussusception, you want to do an abdominal ultrasound. XLAP would not be there because you have no rebound rigidity or guarding. Air or contrast enema, that would be seen for meconium ileus. And only for upper GI pathologies do we do the contrast from the upper section. So this is exactly from my Step 2 CK rapid review course. It's a set of videos that are very integrated, has not only NBME style vignettes, but customized questions from UWorld on the bottom that you can use in your question IDs. Failure to pass meconium, here's going to be the diagnostic schema. When you see a baby on your USMLE, there's not going to be stool for the first couple days. You're going to be thinking meconium ileus, that is associated with cystic fibrosis. You're going to be thinking of an anatomical condition, anal atresia, like Vactrol syndrome, and you're going to be thinking about Hirschsprung's. And why did we put that in here? Jake, what do you think? Why did we put both achalasia and Hirschsprung's together? I know we talked about it before this.
Yeah, because it integrates the principles of the physiology and the somatic topic distribution of the layers, right, of the GI tract, and how the myenteric and Meissner plexus ties all into these concepts.
Absolutely. And guys, this is it. We want to integrate both step 1 and step 2 together because they build off of each other. Let's do a quick compare and contrast. Meconium ileus, you're going to have mucoid-like stool, abdominal distension associated with cystic fibrosis. And remember, the management is going to be a gastrograph and enema, because right at that terminal ileal junction where there is that insipated stool, that hyperosmolar therapy is going to loosen it up, and then the baby is going to poop. Hirschsprung, you're going to get bilious emesis, abdominal distension, and you're going to have that characteristic squirt sign, which we saw in the vignette. We're going to confirm with rectal suction biopsy. You won't see the myenteric plexus, and then the management is going to be surgery. Remember that in meconium ileus, you think of microcolon, whereas in Hirschsprung, megacolon. This one is cystic fibrosis. This one is trisomy 21. Hey, just to push it to you all, because I know we're reaching the end of this webinar. What other GI pathology is associated with trisomy 21? Go ahead and put it into the chat. What other GI pathology is associated with trisomy 21? Excellent. I'm seeing many duodenal atresias, and you're absolutely correct. Remember, that also presents with bilious emesis. However, you see double bubble sign, and that is key.
Amazing. Thank you so much for that. And for everyone tuning in, thank you so much for staying so active and engaged with this presentation. It's been super exciting for us to finally collaborate together on a little presentation for you guys. And I think this is just the start of many webinars that we're going to kick off to help support you. And with that being said, if you want to follow through with our journeys and all the topics and study processes that we've preached today, be sure to follow us on our Instagram. I know Dr. Damani is also on Twitter, and of course we have both our YouTube channels as well. So be sure to stay connected through our channels there, as we'll be posting updates frequently with events like these that are upcoming and on the horizon. And this is just the start, everyone. I know we dove through the 3 prompts today, which I think are a great cornerstone and foundation to start incorporating ChatGPT into your study process. But this is really just the beginning. As you see on screen here, these are just a few examples of more prompts that we're generating and that will come in the coming weeks, whether it be, again, integrating various concepts, something we preached and honed in on today, linking symptoms to pathophysiology, diving a little bit more into the step 2 CK domain and tailoring prompts more towards the management aspect of the case. I know lots of you probably use Anki, and we know how important active recall and flashcard learning is. And so generating a vignette style Anki card, if you're again having difficulty with a certain topic and you want to learn how will I actually be tested on this topic on exam day, right? It's one thing to memorize the facts and just the basic principles, but how is that going to come up on test days? Really what you want to focus on, especially in your later stages of prep. So integrating that, and as you can see, just going through the rest of them as well. We will be doing a Q&A now, and I just wanted to direct you also to the QR link that you see there. If you guys have your phones out, scan that QR code. What that's going to do is going to take you to a type form. If you guys want to be the first people to be notified when our new prompts that you just saw on the previous screen are released, be sure to fill out this type form. You'll get an email immediately when those are released, as well as any events that pertain to how ChatGPT and USMLE can help supplement your study. So with that being said, we're going to open up to all of you. If you guys have any questions for Dr. Damania, for me, or both of us, we'd be happy to spend the next 10 minutes going through some of those questions for you all. And thank you all just for participating and joining us today from wherever you are located. And best of luck with your upcoming exams, whether it be step 1 or step 2.
Awesome. Jake, this was awesome. And for all of you, we have created a unique little domain, ChatGPT, USMLE.com.
Yeah.
Feel free to visit that. It's going to have all of the prompts, which we talked about today, including the embedded Loom videos and the prompt engineering framework. I'm so grateful you guys are here. Welcome your feedback. Let's go ahead and get started with a Q&A. So if you all have a question either on Instagram, YouTube, or on Zoom, I'm going to go ahead and read it out loud, and feel free to either address it to myself, Jake, or both of us. So we're going to start out with our first question, Jake. I'll have you handle this. I'm struggling with creating a study step 1 schedule with ChatGPT. Is there a way you suggest doing so?
Interesting. You know, I haven't explored the schedule generation aspect of ChatGPT as of yet, but I certainly think that given kind of that 3 C's format, we could definitely generate and tailor a study schedule that will relate to, and I think we can incorporate the elements of what makes a good study schedule. So, you know, we think about the timing. How much time do you have to study for step 1? What resources do you have access to, or do you plan on incorporating in? Is it UWorld? Is it you know, the HyGuru pass fail course? Is it my guides? Is it you know, NBMEs and all that kind of stuff? I think that's a great idea. As of now, we don't have that created, but I certainly think that we could explore that domain together and figure out a way to help supplement also the organizational aspect of the study process and tailoring a specific plan based on some parameters that I just spoke about. So great question there, Maria, and fill out the type form. We'll get to that one, and you'll be notified.
Awesome. Jake, you want to read another question? I know we have a lot, so feel free to read whichever, and I can go through that one.
Yep, for sure. And she just followed up and said 3-4 month period with, yeah, and she's talked about some resources, so we can definitely get to that. Someone was asking about here, any tips for M1s here? Not sure if we have a lot of M1s here, but I don't know the best way to study during first year, or if we should already start studying for step 1, and what resources. That's from Zarek.
Yeah, absolutely, Zarek. Well, I really appreciate you joining. I know M1 year can sometimes feel like drinking from a fire hose. So the first thing that I would make as a goal is not just a resource, not just go into a certain course or something like that. I would really reflect on what's the best way which you learn. A lot of people say active recall. Okay, great. That's the big buzz. However, specifically, how do you learn? And in my opinion, sticking with your school curriculum and just really marching through the school curriculum, getting organized, understanding what's your process of taking a slide deck and learning from it, that is going to be essential, especially for your first 6 months. Then I would incorporate correlating with first aid, just correlating, nothing crazy. And eventually grabbing a question bank. It doesn't have to be UWorld first, something like RX, the boot camp, even a guide like Jake's that has NBME style questions. And then as you march into M2 year, if your curriculum is going to be organized with pathology being a focus on the second year, then doing UWorld with every single pathology block is going to be really essential and really great. Great questions, Zarek. Best wishes on the beginning of your M1 journey. All right. We have another question here. I was using the prompt side by side when you were explaining, but my answer did not include the first aid key points. Any advice? That's from Shubham.
Yeah. So I think, and feel free to chime in on this one as well, because I know we've discussed this ourselves. You know, when it comes to ChatGPT at the moment, guys, if I'm putting in the prompt somewhere and you're putting in the prompt somewhere and it's at the exact same time, exact same parameters, ChatGPT will, it's almost impossible for it to be the exact same output. And so small variation within those parameters that we gave the ChatGPT are expected. Of course, we tried to create a robust prompt and use with using all the principles we've discussed throughout this session with the NBME Writer's Guide and just you know, providing examples, types of questions that are expected in a step 1 versus step 2 test environment. And so if some elements are not exact to what you saw today, that is okay. It is still working. Feel free to play around with it, maybe trial a couple different questions until you're happy with that. If you do specifically want the first aid key points, you could follow up and say in your ChatGPT, can you also include a section for first aid key points? And you can pose that back to the ChatGPT, right? ChatGPT will still respond and engage. You've already provided that first prompt to it, and it will then subsequently add that to part of your output. So I think if you wanted to add anything there, Dr. Demania, but I think that's just how it's going to work at this stage, at least.
Yeah, absolutely. I think that this technology is ever so evolving. I do think that there are limitations. We've put it at the bottom of our guide as well, that you want to verify the input. You want to have that human check to make sure that you have accurate information. This is something that not only medicine is struggling with, which is definitely high stakes, but other fields as well. And so this goes to Layla's point, who just posted in the chat. I typed in a question from the NBME. It gave me the wrong answer, but then I told it the right answer and it explained it. And again, this is exactly how sometimes humans are, right? We are imperfect. And so your goal is to, again, remember that last point of the 3C models, clarify. Give ChatGPT something to center itself on. If you see that the answer is D, well, it can work with you giving the vignette and providing it the right answer. Maybe you'll get a more fruitful output. So not sure, Layla, if it happens super often in our trial and error beta testing. We didn't see it happen too often, but we do know that it does happen, and quote unquote, it just depends. I have one more question in the YouTube chat box, and maybe Jake, if you have any on Instagram, but how much does shelf content contribute to step 2 CK? Should I put more emphasis on studying shelf or wait until step 2 CK and focus more on clinical? Jake, I'll take this one real quick. And that is that step 2 CK is basically all of your shelves combined. The data, looking at the literature, the data suggests that if you kick ass on all of your shelves and you do your best and finish UWorld with every single shelf, and you do well on internal medicine, which is the majority of step 2 CK, you will do well on the step 2 CK. So put your heart and soul into mastering each shelf.
Amazing.
Jake, do you have any questions on Instagram that you wanted to go through?
No, I ended the live about 15 minutes ago.
Okay, great.
But there was 800 people on at one time there. So we got a lot of people tuning in there. I think we had over 18,000 people over the course of the presentation tune in. So that was exciting. I did just quickly see Ahmed ask about how many pages are in my rapid reviews. I'll just touch on that quickly. So we've essentially cut first aid in half. So if the cardiology section is 35 pages, then my guide will be in and around 20 pages, just under 20 pages. And that's the same for all disciplines. And then I think there might have been someone else clarifying something with ChatGPT. Yeah, so you can use 4 and 3.5. It works for both, the free version as well. But yeah, I think with that being said, everyone, fill out the type form if you're interested in more prompts to come. Feel free to email us, go to our Instagrams, and you'll see our contact information if you have specific inquiries or questions related to the presentation or anything about your USMLE journey. We're here to support you. And this is just the start of HyGuru x MedSchoolBro. So stay on the lookout for some exciting things to come. And thanks everyone for spending your evening, morning, or wherever you are with us today. It was a pleasure to do this with you all.
Awesome. Jake, thank you so much for all of your enthusiasm. I know you have to head to rotation soon, and I'm going to be calling it an early evening, and thank you all for joining.